And just as a reminder to all who are in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Judge Adrian. Here. Ms. Yarham.
Here.
Ms. Gibbons.
Here.
Mr. Cross.
Here.
Judge McClellan. Judge McClellan is absent at the moment. There is a quorum. Yes, Mr. Chair, we have two people. The first one is Mr. Pat Gladora. If you can come up.
Hello. All right. Chair Adrian, Vice Chair Yarum, and members of the Cuyahoga County Juvenile Court Advisory Subcommittee, my name is Pat Gladura, Policy Strategist at the ACLU of Ohio and member of the Greater CLE Youth Justice Collective, a coalition comprised of the ACLU of Ohio, the Schubert Center for Child Studies at Case Western Reserve University, and the Children's Law Center. Thank you for the opportunity to provide public comment here today. The Greater CLE Youth Justice Collective, in preparation for today's meeting, has submitted a list of recommendations we would like this subcommittee to take into consideration as you continue to work towards evaluating and improving Cuyahoga County's juvenile court. We have asked this committee to review opportunities to meaningfully implement the Juvenile Detention Alternatives Initiative, JDAI framework, audit Cuyahoga County's use of state, local, and other funding as related to outcomes, including reclaim, to identify gaps in opportunities to keep kids out of local detention and deep end systems, and conduct a review of the Governor's Juvenile Justice Working Group report and recommendations to determine impact and opportunities of proposals on Cuyahoga County youth. We believe these recommendations to be worthwhile endeavors of the subcommittee and within your stated goals and objectives. These recommendations are clear, actionable, and specific, and meant to gather the information necessary to best serve Cuyahoga County's youth and ensure the county is doing all it can to give kids involved in the youth justice system the highest quality rehabilitative services. Our letter goes into greater detail on each recommendation. We're happy to provide follow-up and aid as you work towards these goals. Thank you for the opportunity to speak today.
Any questions?
Thank you.
And you got provided Jean copies of it?
Yes.
And I can make copies for you all. And the next speaker is Ms. Leah Winsberg.
Good afternoon, Chair, Vice Chair, and members of the subcommittee. My name is Leah Winsberg. I've spoken with you all before. I wanted to just take a quick moment. I did provide some slides or kind of a snapshot of some slides around data that Laura had indicated might be helpful for your subcommittee in understanding bind over, serious youthful offender, and some other kind of what we call deep end system outcomes for young people in our county compared to our state. So those, I believe, were distributed to you all sometime in August. And since then, I have transitioned, and I am now in a new role with the Cuyahoga County Public Defender's Office as their community engagement attorney. So I wanted to just let you all know about that change and reiterate that both myself and our office is here to be available as a resource and support for you as you continue to kind of further define and get into this work. We do have access to the same data that was available that I provided you a little bit of a snapshot of, and our office will be submitting some recommendations to your work group as well. We weren't able to make today's deadline for you, but those will be forthcoming, and we hope that they will be concise and clear and give you all some indication of where we think the priorities might be for some meaningful change. So I just wanted to let you all know that that will be forthcoming. Thank you.
Thank you.
No one else is signed in. Second.
Readiness on the motion? On the motion, hearing none.
Aye.
Aye.
I believe he is on Zoom. Patrick, can you hear us? Hi, did you want to introduce yourself?
Gabriella. All right, Gabriella, sorry, you sound. That's okay. Hi, Chair and Vice Chair and members. Thanks for inviting me to be here. I noticed I wasn't on the agenda, so hopefully it's not a surprise that I'm here presenting a surprise. I'm going to speak pretty, informally, but I do have actually a number of slides to share. I was invited to come and share with you largely because of the work I did with the Governor's Juvenile Justice Work Group that was appointed in the fall and came out with recommendations just last month and sort of has a lot of implications. Oh, sure. Oh, sure. I'm sorry. I thought, yes. Gabriella Celeste with the Schubert Center for Child Studies at Case Western Reserve University and member of the Ohio Juvenile Justice Working Group. Thanks for stopping me. All right, so I thought I've got about 15 minutes. I'd spend about half the time providing context and the other half the time giving more of kind of highlights on the recommendations and where I see some opportunity for local work. So go ahead and click away. This is just a list of the members' apologies for, and the recommendations. As you can see, there are a lot. I will not be covering them all. I did want to point out that Habiba Grimes was also a member of the work group, and she's a local behavioral health provider at PEP and was a really instrumental part of the work. So I just wanted you to see that there's a lot of material in there. I hope you get a chance to take a look at. Just to kind of level set, we have 3 prisons, youth prisons in our state. One of them, Cuyahoga Hills, is in our county. You can go ahead and hit the next one. We have, in addition, 11 community correctional facilities for youth. You will note we do not have one of those in our county. We also have 40 or so juvenile detention centers in our state. So we have a lot of places where we hold kids. You can go ahead to the next slide. I did want to point out, historically, that was not the case. In fact, there was a huge period of transformation. And this is data from DOIS that shows that basically the underutilization of CCFs. So the red bar is basically the capacity over the years in our CCFs, and the blue bar is how many kids are actually placed. And then you'll see there what we basically have in terms of occupancy rate. You can go ahead. All of this, I just want to remind us that while we're talking about this population and the challenges it face, and we are concerned, of course, about crime, the reality is youth crime has been trending down for a long time, since the mid-1990s. This chart shows that when we look at the younger age groups, the kind of 15 to 24, the 15 to 17 is persistently almost and lately always been the lowest among the groups committing, and this is looking at violent crime. And you can go to the next slide or the next graph. These are our filings. I thought I had a different one, but this is our local county filings. And again, you just see the decrease over time. And then if we look at, so that's our filings, but when you look at actual adjudications, I just pulled the data, that's the last 10 years. And it looks pretty flat, but in truth, from 2014 to the last year, it's actually been a decrease, or about 4,700 in 2014 adjudications around the state. That number's at about 3,800, but our county, you can see, I just sort of highlighted here, accounts for the highest number of adjudications persistently, and the latest year we make up about 17%, 16.5% of those. That's right, of the state adjudications. And then since gun violence has come up as a discussion point, I did want to share this data. This is historical gun specification data, and our county again accounts for the highest number there at 500 over the course of 15 years. So while those numbers overall, gun specs have been increasing to some extent, and that's a concern. You'll see that I think over the 15 years we're talking, I think it's 500 offenses, gun specs. The next highest county is Franklin at close to like 400 or 380. You can go. 15 years. That's historical. Not the last year. No, sorry, that very last line is because it's, this is the data snapshot. It's 2024, they haven't completely added that data. So the best last number would be the 144 total in 2023 gun specs in DYS. Yeah, thank you. I'm going pretty quickly to just kind of get through some of this, but stop me at any time and you'll have this data to check out. I also wanted to point out that sort of trends in admissions in DYS, these 3 prisons primarily, and releases, you'll see, I think if you click one more time, I'll kind of circle, yeah, these 2 back during COVID, essentially right before COVID, it was about same amount of admissions to releases. During COVID, we saw understandably less admissions, more releases, but you'll see since then we've had increasing admissions. But I think what's also important is really decreasing releases, which basically means kids are staying longer in these state facilities. And this poses an opportunity, I think, in a question about potentially reentry and trying to really help kids move back to communities more quickly. And that's statewide. Yep. You can go ahead. I just wanted, you can click the next one too, because I don't know what happened with the yellows there. Oh, right. So because bind over remains an issue, and in fact was an issue, even though the governor's group doesn't have control over bind over either, really used it as an opportunity to recognize what are some of the pressure points in the state system and some of the issues, and bind over is certainly one of them. And so here, this is a data point we looked at and wanted to make sure you're aware of, that while we've seen some decrease in bindovers from the sort of record highs in a couple of years ago, our county continues to still be like 3 times the number of the next highest, counties, next 3 counties. So you'll see Franklin, Stark, Summit, and Hamilton. It was Franklin, if you're interested, it's always been Cuyahoga as a complete outlier. Franklin and then Hamilton. In the last year, actually, Summit and Stark have had an increase as well in bindovers. Is there some doubt that the government was found for why? I think for that specifically, those differences in the counties, no. We didn't sort of drill down that far. I think the group was more interested in how do we think more about what's appropriate for youth who find themselves caught up in the justice system, and are there better ways to address the needs of youth who are currently being bound over that may be better met in a youth facility. And so the report, as I'll mention, makes a few statutory recommendations. Again, even though the governor doesn't have statutory control, wanted to make some recommendations around admissions and sort of what's the pipeline potentially to this system. Bindovers is a piece of that. And then I just included this slide before we move on, because the next one, just as a reminder, when we think about the kids in the system, we talk a lot about trauma. I don't think, yeah. But it's just the importance of recognizing that too many, in fact, this is a study that included our county specifically, and if you click one more time, you'll see that our county makes up the kids in our juvenile system, actually more than 2/3 of them were previously in our child welfare system. So it's a very vulnerable population that we're talking about here. You can go ahead to the next slide. So the next couple slides are just to point out the 3 big issues that were brought to the governor's group's attention. One was acts of violence, the second was lack of access to behavioral health supports, and the third really was staffing. So these are slides that the director, Amy Ast, shared with us to give a sense of kind of what on the violence front, and this is in the facilities. And basically, because we don't have time for me to go into the details, I just want to point out the red line is youth on youth, the blue line is youth on youth fights, the blue is youth on youth assaults, and the green line is youth on staff assaults. And these are actual average monthly acts of violence per youth. So you're looking at, you know, there was a decrease certainly during COVID, and then an increase that had raised some significant concerns. But there's actually been a decrease on staff, youth on staff assaults. You can go to the next slide. The second piece just to highlight is the behavioral health treatment. You remember 77% of the kids have behavioral health issues, and yet this is again data shared by Director Ast with us. The average monthly treatment hours by licensed behavioral health staff, the blue line is like groups, you know, group work. The red bar is one-on-one sessions, and you can see how low overall the average monthly treatment are for each youth over the course of a month. The line above is the filled behavioral health positions, and you can see a real decrease, you know, particularly in the last couple of years in staff, which has raised behavioral health staff in particular, but not just that, and you'll see that in the next slide. This, and if you click again, I think I circle a couple things. Youth specialists or correctional officers, behavioral health staff, and this is by facility. And I just want to draw your attention to the total on those top ones. You know, over nearly a quarter of the staff, there are vacancies in the correctional staff, and 41% of behavioral health vacancies. So when we see kids, this focus on acts of violence, you can't look at it in a vacuum. You have to pay attention to the fact that they're not actually getting adequate time out of their cells, getting adequate treatment, those kinds of things. And I'll just point out in the last, I think if you click one more time, that actually Cuyahoga Hills, of all the facilities, has the lowest staff vacancies. So that's something, again, that we thought was positive. This is just a collection of findings from Elizabeth Kaufman's studies to just remind us, because this is, I think, why you all in part are here and are paying attention to really how do we keep kids, to the extent we can, out of these systems. Because the reality is the deeper they get into the justice system, the worse the outcomes are, and in fact, the less safe we all are overall. And I won't go through all of those, but these are all demonstrated in research. So it's a really important and critical opportunity for us to be looking at how do we divert these kids? How do we support them? Oh, click that. That must have been an extra. So with that, I'm just going to move, next slide, to the report. I said the report had 26 recommendations. I tried to sort of put them into 5 or 6 buckets, and then I'll talk a little bit about one in particular, and then where I think we see some opportunities. So the big one, if you haven't read it in the papers or seen it already, is this push for smaller is better, really smaller is smarter. It's the idea of now taking the remaining 3 prisons and really replacing them with smaller regional facilities that are really designed for youth. I'll come back to that in a second. The second is targeting kids in those prisons, the juvenile correctional facilities, or JCFs, as the deepest population by making statutory changes and supporting 3 new CCFs in the state of Ohio. One of those could be in our county. So the statutory changes are things like getting rid of mandatory gun spec time, not holding kids for lower felony offenses, F4s and 5s in our state prisons, looking at bindover and getting rid of mandatory bindover, and looking at the age of admission. So all of those recommendations are in the report, and you can learn more about it. The third area is around more local detention. And again, the idea is how to support local detention and increase safety. The fourth is a whole set of recommendations around behavioral health supports and cross-system supports for that. And then finally, there are recommendations around the good evidence of credible messengers, family supports, and things we can do to improve staff wellness and staff recruitment and their own development. I want to, next slide, next couple slides just tell us what do we mean about the smaller is better. And I think this has, while we're talking about the DYS facilities, this is also why I think there's real value in us looking at a CCF in our county. So one, is that there's a lot of evidence now that when we talk about smaller is better, we're talking about really these kind of 4 design principles. Use small scale, that it's locally sited and integrated with a community, surrounding community and those supports, that it comprises therapeutic designs like, its layout, communal areas, lighting, those kinds of things. And finally, and perhaps most importantly, is this, that it's designed to promote relational security. If you click again, there's a lot in the report around this because it's such a really important way of thinking about how you actually do correctional, relational security in a correctional space. The idea here is that it's you're establishing safe and therapeutic guidelines, that you get to know each individual youth, because if you know the young person, that can really inform how you use management and de-escalation, that you see youth not merely as risks to be managed, but really resources to be developed, and that staff themselves in doing this begin to see their work as much more purposeful, and as a result, they feel part of a larger organization that wants them to thrive too. Other benefits, if you click again, are benefits to officers and staff themselves. They're less likely in a smaller facility to have large groups challenging their authority. They can see more easily interactions. They can get to know the prisoners. This is from mostly adult research, because we don't have a lot of this in our country right now. We have it in a few states. But they tend to be less bureaucratic, so less kind of warehousing assembly line. Prisoners themselves report feeling less stressed, safer, and much less likely to rely on things like gangs for protection, which is in the youth system primarily how kids often get involved in gangs. You can go on to the next slide. The last set of kind of advantages, gets to the violence piece I wanted to point out on relational security. There's this research that is just came out, I think, a couple years ago that looked at violence in correctional facilities, and it found that actually institutional violence, even more than what kids might have been exposed to in their community, in their neighborhood, it can be much more harmful and make kids much more likely to engage in future violence. And then the reaction, understandably to some extent, you have sanctions when kids are violent in a facility, things like loss of phone privileges, family visits, recreation. That actually further isolates youth and increases their likelihood of using more violence. And so this is where the relational security can make such a big difference, because they can be a really critical buffer. And this research that's been done now shows that youth who see staff as protective and legitimate, treating them fairly, are much less likely to engage in violence. So we see that more possible in these smaller facilities. You can click on all of these as I'm talking, because the last thing around smaller facilities that I think for our county we should be thinking about this in particular, because we have such a rich array of community behavioral health providers, but also neighborhood groups and faith-based groups and organizations that really are looking to engage with this group. Having the smaller is better is going to allow an opportunity for connecting with those resources more, allowing kids to forge bonds with mentors, facilitate more family involvement. It may even serve as a resource to our community for things like restorative justice and civic engagement, volunteer programs. And finally, on reentry, this is a really big change that's happening in our state with Medicaid. Starting January 1, 2025, there's a mandatory statutory Medicaid rule that is essentially going to require that kids who, prior to their release and then upon release, have access to Medicaid supports as part of their reentry. So working with our providers before kids are released and really connecting them with these opportunities is going to, and having Medicaid support do that is going to be a real opportunity for us. I think the last slide, I just want to say, looking forward. Yeah, so I highlight 5 kinds of things for you all, I think, to take from this as you look at, like, well, what do we do now? I guess the first thing is that the capital, just to let you know, the capital budget has already provided money for replacing one of the juvenile prisons and for creating a CCF, state capital budget. Now, the state is proposing that Cuyahoga Hills be the first prison. I will just say personally, and we can talk about this another time, but when you look at all the data, actually Cuyahoga Hills is the best performing correctional facility, and I think they should start with one of their poorer performing facilities. I also think it puts us in a better position for getting the first CCF. And I do think that this is something our county should be pursuing. There is money in the capital budget already for the first CCF. There hopefully will be in the next capital budget money for 2 more, but I think we need to get it while we can. Third, there is an RFP at the state level. They're going to be bringing in a national expert that's looking at the state prisons, but also at CCFs and a selection of our juvenile detention centers. I'm glad to say that our local county partners, Cuyahoga County the Juvenile Detention Center, is volunteered to be a part of that. So there will be real learning from that. I think the 4th area is with the state looking to augment behavioral services with local providers. We can really kind of leverage our local dollars with the state money to really fortify not just behavioral health services, which I think are key, but other kinds of services, whether mentors, grieving support, restorative kind of support, a lot of things. So I would urge you to look at that. And then finally, I do think there's a role for this committee to consider in terms of state advocacy opportunities with local impacts. I mentioned the kinds of recommendations that are included in the report for the Ohio General Assembly, but also Governor DeWine's, this next budget will be Governor DeWine's legacy budget. This is his report. I think there will be opportunities in the budget potentially for you all to advocate. So with that, I will stop my remarks. Thank you. I'm sorry I went over a couple minutes, but hopefully this is helpful. Sure. Any questions, or you want to hold on to those?
Take some time to digest and go through it all, but yeah. I think we would love to have you back at some point when we can.
Sure.
Are you rushing off, Gabriella?
No, I was going to stick around and hear Patrick.
Patrick, just.
Sure. Yeah. Thank you. Do you want me to just stick up here and turn off the?
Yeah.
Okay.
Yeah.
I apologize. I can't really hear the speakers at the tables.
Yeah. Oh, can you hear us now?
Yes, thank you.
Our mic was off. I was just thanking Gabriella for her hard work. We're going to have her stick around. We're going to hold questions for after you complete your presentation.
So would you like me to begin now? Okay. Thanks very much, and good afternoon, everyone. My presentation is going to go from the very broad and extraordinarily helpful review of all the data that Gabriella just provided to a much more narrow conversation specifically about gun violence. I'm not going to go into lots and lots of background data. I'm going to spend much more of my time on what other cities are doing and what seems to be working to curb gun violence. I do want to make just a couple observations because just as with the data that Gabriella presented, the general public and often a lot of policymakers don't really fully understand the data and have some assumptions. So first, generally around gun violence, crime, as well as overall crime, consistent with the data on youth that Gabriella presented, there was an uptick in overall crime, including violent felonies during the pandemic. The latest data we have are reports from police agencies to the FBI, and that data shows fairly significant reductions year over year in crime overall and in violent crime. That's the first observation. The second is that, again, there's a general impression that violence by young people are really driving the violent crime, gun crime in our communities. And actually, young people under 18 are involved in less than 10% of all gun injuries and deaths in most cities, generally around 7 or 8%. Another observation is that the availability of guns has grown exponentially across the entire country over the last 15 years and really accelerating again during the time of the pandemic. And whether these guns were obtained legally or illegally, the guns, based on surveys and interviews, the guns are seen by those who own them as essential to self-defense and survival. And the reality is that young people with guns use the same language and make the same argument as older people in the suburbs with why they feel they need to have guns. And that is that the world's become a dangerous place and they believe they need the guns to protect themselves. Now, obviously, this is an even more powerful rationale for a young person who's living in a neighborhood where violence occurs more often. And finally, and this is an important observation about the data, this is a real problem. I don't want to suggest that gun violence among young people is abnormally low. In fact, it did in fact spike up. And although there's been some reversal of the trend, the rate of gun violence arrests that include young people are still higher than they have been in the recent past. Nowhere near as high as they were in the 90s and the early 2000s, but this is a real problem. There are real issues going on in our communities with young people involved in gun violence. But again, it is a very small percentage of the overall gun violence problem, less than 10% of all gun violence. And compared to longer ago, 15, 20 years ago, the rate of youth violence committed by young people is much lower. So now let's just drill down a little bit on what research tells us about the dynamics of gun violence in communities. Because if you're going to attack a problem, you kind of have to understand what's causing it and what's keeping it going, right? So with some exceptions, let's be clear, there are always exceptions. These are general trends. Gun violence appears to be concentrated among very small networks of people, whether you're talking about youth or you're talking about adults. Evidence, research evidence, as well as the experience of officers on the street will tell you that less than 1% of the population, certainly of the youth population, accounts for 50 to 70%, depending on the city, of the instances of gun violence. So that's one observation, right? So very small networks of people who are in close contact with each other, causing large proportion of the gun violence. So if you're looking at prevention and intervention, that's where one would reasonably focus. Another observation, this is the public health perspective, but it makes a lot of sense. Gun violence leads to more gun violence because of retaliation, because of escalation. The estimate is that for every one shooting, there are 3 additional shootings. And do the math, it starts to grow exponentially again within these small groups. Another observation, this is obvious, but I think it needs to be said, that gun violence tends to be concentrated in particular neighborhoods, in particular communities. This is not geographically evenly distributed across an entire city or even across an entire community. The kinds of neighborhoods that are plagued by gun violence are also plagued by lots of other critical challenges and barriers. Concentrated opportunity, substandard housing, underperforming schools, limited employment opportunities, high rates of child welfare involvement, high rates of family disruption, whether because of the child welfare system or because of families breaking apart, limited recreational opportunities, and high rates of arrest for drug trafficking. So when you combine the data for neighborhoods with those kinds of characteristics with the hotspots that police departments often track, you'll see an incredible overlap. So again, small networks of people in identifiable neighborhoods, in identifiable communities, matched to hotspots to show what has happened in the recent past, start to paint a picture of where the gun violence is happening. So I want to move on to talk a little bit about the approaches that different cities have tried, and Cleveland is not alone, and by the way, is also trying some of these things. But I'm going to give you more of the national perspective and some of the evidence for what works best to curb gun violence among youth and adults, but especially among youth. And it's like, think about it like concentric circles of targeting, right? So there are individual young people who are at high risk. There are groups of young people who are at high risk. As I said a moment ago, there are neighborhoods that are at high risk. And then there are interventions that really focus much more broadly on systems and policies and programs that affect entire areas. I think a lot of what Gabriella was describing are the systemic interventions that are critical to dealing with all of youth crime, but certainly gun violence. So I'm going to go through 5 examples from cities of these kind of areas of intervention, just to give you a feel for what these interventions look like and for what the evidence has been that they work. So I'm going to start with the individual young person. And there are a number of what are called violence interrupter interventions. They share a lot of common characteristics, which I'll talk about a bit later, but they are things like safe streets, cure violence, the hospital violence interrupters, and they've been tried in lots of different cities with pretty good success. And by pretty good success, I mean on the order of 20 to 30% reduction in gun injuries and deaths. With a public health problem that often leads to death and more violence, that is a huge payoff. So let me just tell you a little bit about what these programs look like. These are programs that really identify those individual young people and young adults who are at very high risk of becoming involved as either a victim or a perpetrator of gun violence. And then they intervene intensively with those individual young people. All of these programs rely on some version of what Gabriella already referred to as credible messengers. What's a credible messenger? It's somebody that a young person is going to listen to. And in large measure, it's because, as credible messengers will tell you themselves, I've been there, I've done that, I've figured out how to get out of that, so I can talk in a more credible way to a young person than a social worker coming in from the suburbs. So credible messengers are part of most of these programs. As I say, each of these programs have slight differences. I'm going to talk about their commonalities in a moment. I'm not going to go into any detail program by program by program. There's lots of information about it, and it's really just to give you a theme. I'm going to use the example of hospital violence interrupters because I think that's one that just is easy to understand from a common sense standpoint. Young person comes in with a gunshot wound. There are people at the hospital who immediately engage, if possible, with that young person, but more importantly, with the family that shows up, with the friends that show up, what happened, who's involved. They get in touch with law enforcement. They start to figure out where's the most likely possibility of retaliation or escalation. And then they have contacts in the community who will start to work to try to do enough conflict resolution to get through the next 48 hours. Get through 48 hours and you got a shot getting your arms around this. So that's an example of violence interrupter. It says if there's an incident, there's very likely going to be another incident or a series of incidents unless you get in and interrupt the cycle. The second category or example of these interventions, you can use different terms. All the different cities use different terms. The generic terms is group violence intervention, focused deterrence, sometimes called targeted deterrence. The classic example started in Boston with ceasefire. This is an approach that's been used in Boston, Chicago, New Orleans, Oakland, lots of other places, Stockton, California, sometimes in conjunction with the more individual approach. But this is, again, an approach that is simple in design, difficult to do, but simple in design. So the design is essentially to say, again, small networks. Now, sometimes these are organized gangs, right? And sometimes gangs that are organized even on a national or state level. Sometimes it's a small set in a neighborhood. It's 6 guys, and it's usually guys, who are together as a set in the neighborhood, and one of them gets shot and by another set, and this blows up, right? So the approach is, for want of a better term, I don't love the term, but it sort of captures it. It's like a combination of carrot stick. In what is supposed to be and needs to be a respectful way, they do what's called a call-in. They bring together this group of young people, whether it's a gang or folks who are known by law enforcement officers on the street, by probation officers, by community groups. Yeah, this is a group of folks who are involved in activities that either lead to gun violence or they've already been involved in gun violence. And they basically sit them down and say, look, we want to put in place a ceasefire, and here's the deal. We have looked at each of your individual records, and the next time you're arrested with a gun-related offense, here is what your consequence legally is likely to be. This is what you're looking at. You know, whether that's years in prison or whatever it is, and it's usually years in prison. You now know that we know exactly who you are. We will be paying incredibly close attention to you. We have information all around you. And so if you do something, we're going to know. And we are concentrating resources. We're bringing in extra resources specifically around your group. So it's not just going to be Officer Brown on the corner or Officer Jones in a squad car. You're going to be surrounded, and you won't even know when you are and who's around you. And if something happens, we're going to know about it. However, we have also a legitimate and honorable, if you will, way out. If you're willing, we will surround you with supports and services and job opportunities. Some places have actually put in place financial incentives. We're going to work on the problems your family has, the problems your kids have, the problems your partners have. We're going to do whatever it takes to create a new life for you together with you. And we have partnerships, and they have partnerships with community organizations that these groups hopefully know. And again, the credible messengers are at the table to say, I've been there, I made a different choice and spent 15 years in the state penitentiary. So believe me when I tell you, you might be thinking this isn't going to be a big deal, but listen to me, I've been there, et cetera. So this is kind of the group violence interventions, basically looking at the group as a whole And basically, you got to follow through, obviously. The third is, again, more of an individual kind of approach, but I set it aside or just separated somewhat from the violence interrupters because it's a much more intensive 360-degree set of interventions. And this is to take what in the psychotherapy world is called cognitive behavioral therapy, create an adaptive version of that, cognitive behavioral interventions, and to combine that with what are called wraparound services. Now, what does all that gobbledygook mean? It basically means that young people, especially young people who've had trauma, young people whose brains are still developing, young people who have been denied lots of opportunities to grow and develop, often have patterns of thought and patterns of seeing the world that are self-defeating and self-destructive, and often leave them very open to trigger violent response to what they may perceive as a disrespectful interaction, as an example. So if they see somebody disrespecting them, they've got to hit back as hard as they can, right? So the cognitive behavioral side of this, again, not using psychotherapists, but using more credible community folks, credible messengers, et cetera, who are trained intensively in this approach, is to engage them and help them start to rethink, if you will, and re-experience their world, which requires, not an hour a week or 2 hours a week of therapy, but 30 hours a week, 40 hours a week of constant contact and group contact that is all around relearning and re-understanding the world. The wraparound part of this is similar to the wraparound that I talked about earlier in focused deterrence, but it is much more individualized, much more intensive. And I'm going to give you just one example of this to give you a feel for what this is like. There's a program that had its start in Chelsea, Massachusetts, moved into Boston. It's in multiple sites in Massachusetts now. It's in several sites across the country, including in Baltimore. And I'm much more familiar with the Baltimore version of this, although I spent a lot of time with the founder of this and understand how she created it. Roca, unless I don't speak Spanish, I was going to say, I don't speak Spanish at all. My understanding is Roca is the word for rock, but it's basically like we're going to be the rock that somebody can hold on to. The most important thing to know about Roca is that if somebody shows up at their door and says, I'm ready to make a change, they say you're at the wrong place. They send them to a place that's ready to work with somebody who's ready to change. They reach out to the people who say F you whenever you approach them. And they reach out again and again and again and again and again. They don't take no for an answer. They expect for somebody to say, I don't want to have anything to do with you. They keep coming back. They keep knocking on the door, showing up at the corner, sending other people to talk to them. And if they engage someone, they expect them at some point to say F you and stalk off. And they reach out again and again and again. So again, it's a unusual program. They're data crazy, so they track everything. They've had fantastic results with very deep end young adults. So that's just one example. The next two are much quicker. I'm conscious of the time. I know you're short on time. A number of cities have put in place violence reduction councils, sometimes called homicide review panels. This is where you bring in all the actors who have a stake, law enforcement, prosecutors, representatives of the judiciary, service providers, community people, young people themselves, et cetera. And when there is either a very serious gun injury or a homicide, they basically do an intensive debrief and say, all right, what can we learn? And they capture that and feed it back into the system. Again, I won't go into any more detail than that, and I'll go into almost no detail in this last one because it's the broadest, and it's essentially in addressing the environmental risk factors that lead to the kinds of conditions that give young people or have young people giving up hope for a path forward other than just trying to survive. Classic example is dealing with vacant houses, dealing with the environment. So what are the common threads here? And again, I'll go through this quickly, and I'll be happy later on to share resources for more detail about that. So what's common about all these approaches? Number one is using data and using other kinds of information to target hotspots, to target high-risk people. Like, that's essential. Second, said before, credible messengers. Third, and this is hard to do, but simple in concept, is trust and collaboration across frontline law enforcement, probation, parole, service providers, community groups, like everybody who has a stake in this problem. These programs will not work if the police department does not trust the credible messengers, as an example. If the sense is, hey, I'd lock that knucklehead up. Like, now you want me to work with him and he's going to be a role model? You got to be kidding me. You got to do a whole lot of work to deal with those very real concerns that a frontline police officer is likely to bring to the conversation. Not just frontline police officers, chief of police and captains and everybody else. Fourth is intense and individualized intervention. These are not inexpensive interventions. I mean, this is like ICU, right? This is saving lives. This is not vaccination. This is not, an aspirin for a headache. This is ICU level interventions. And related to that, finally, sustained resources. These things are not easy to set up. They often take a year or two to actually even get situated to go forward. And so it's got to be a long-term commitment. The good news is when it works, and it very often works, these things, you start to get a snowball effect. Success breeds success. It breeds confidence. And next thing you know, people on the street and communities are feeling safer. I'm going to end with 4 quick recommendations. First, won't be a surprise. I think this subcommittee should recommend to council that council work with law enforcement and the judiciary together to convene all the other critical stakeholders to start this collaborative process, if it doesn't already exist. I don't pretend to know everything that's going on in Cuyahoga County. I'm not from there, obviously. Second, I would encourage the subcommittee to suggest to the full council that what's already happening in the county be mapped so you know where it is, and that it be assessed. All the current initiatives, all the current programs, are they targeted enough? Do they have enough capacity? Do they have enough reach? Are they actually reaching the people who need to be reached? What are their results? Are they tracking their results? If they're tracking their results, what are they? Where are the gaps? Look at what you're already doing, because I know you're doing stuff, and it's important to look at that first. And then finally, again, not a surprise after what I've said, I hope, and that is these are not minor investments, and it's going to be critical to invest at multiple levels. I use the analogy of a fire department. Fire prevention is critically important. You can save so much money, save lives with fire prevention. But by God, you got to put the fire out. So the first thing you got to do, you have to interrupt these retaliatory cycles. You've got to put the fire out, even as you think, what's it going to take to prevent these conditions that lead to this kind of gun violence. So interrupt the retaliatory cycles among individuals, put in the deterrence with the groups, do the wraparound where you need to do it, make the systemic improvements of the kind that Gabriella talked about, and look at your policies. I know that council doesn't make state policy. And so that means collaboration with your state representatives to look at the state policies as they impact Cuyahoga County. Policies can make a huge difference on things like the availability of guns to young people. So I apologize for galloping through that. I'd be happy either now or at some other time to engage in additional conversation. I understand you generally try to stop around 4, so I'm cognizant that I've already held you a bit longer than your usual time.
I'm sorry. Thank you very much. Appreciate your time and your expertise on this. I'm going to ask the members of the subcommittee if they have any questions that they would like to pose to you at this time, or whether we need to chew on this and get back to you later on with additional thoughts that we may have as it relates to it. Bridget?
Well, you know, Patrick, thank you so much. Really appreciate you taking the time. I know you're busy, and I appreciate you sharing all of this sort of zoomed out, more national perspective. I do know that Cuyahoga County, City of Cleveland have some really great resources, many of which are working towards what you shared. I would welcome you to send any specific examples and just to kind of, I think we need to have more of a discussion of like where are still, you know, many of the things you talked about, we have some gaps, we have some capacity issues in programs. And, you know, I am grateful that you brought up some of those real life challenges because those are things that I think that, you know, we know well. We can fund it, but then you've got to get people for it. And I think, you know, I do appreciate your comments on the credible messengers. I do think that's important for us to have people with lived experience at the table. And sometimes that can go really, really well. Also matched with a good clinical intervention, the two can oftentimes work hand in hand really well. So, so if you could forward us your links of sites. I know we've started in Cuyahoga County Juvenile Court to have some small training with ROCA. We have some conversations going on regarding credible messengering. We have contracts with folks that are doing much of that violence interruption work, but I do think I appreciate the mapping this out because I think that's something, you know, Gabriella, you shared, and I think, Pat, you forwarded a letter, you know, really looking at where are we spending resources and what are we getting out of that? And maybe we need to take a step back and look at how to target that better. So that's been a really great takeaway that I will carry with me of like, how are we utilizing some of those intensive resources and are we targeting the right kids? And if not, how do we kind of think about that following some data? So I appreciate you sharing that.
Don't have anything else, just a lot to take in.
Okay. Mark?
I really like to be cognizant of our time. I'm having a real difficult time like digesting some of this, not because of what it is. So I'm a policeman. This is my 44th year in law enforcement, and I have not always been in basic patrol. So I used to run the fugitive task force. So I understand some of these things about, number one, credible messengers. I talk to some of these people now, and the groups, some of the groups that you had showed that need the funding, I know some of them personally. And that's one of the things that they say is they don't have the funds. I also know that I see where we don't have staff, like for the mental health things, which a lot of these youngsters, they actually need it. And it's, I like what he said about the wraparound, the groups. You got to have some support for them, and not all large groups, because that just can get muddied sometime. Having people work together. That was one of the things that I did. I created a task force. I actually was one of the founders of the hate crime working group with the FBI, where I brought all kind of groups, every nationality together and we put something together to deal with hate crime in the city of Cleveland. It was crazy how we reduced it. And so I know that it'll work the same way, but you got to look at who's trying to bring these groups together. And I'm just being real. You got a lot of people, their egos. I don't really give a crap about their egos. I don't need none of them. I just call it like it is. I got my own business. I got a retirement, so I can really care less. But you got to tell some people that egos get in the way to say, hey, this is the way it should be done. And I used to work for Dan Gilbert, who's a billionaire. And Dan Gilbert had a thing like, it's not who's right, it's what's right. Because if you go about who's right, it's going to be who's in power. And just because you're in power, you probably know less than you think you know. And that's the reality. So I'm just trying to get a grasp. I was going to tell the group, I was just, people might have seen me texting, probably say, wow, that's kind of arrogant to be texting. But it was actually the special agent of the FBI, SAC in Cleveland, who was saying that I spoke to them before on working groups with them that they were willing to come one day and speak to our group about what they're doing to help the reduction of gun availability. Because I know I ran it. I wish I was younger and was doing it now. I told them at the FBI meeting, you guys need to do a better job with all law enforcement and stopping the flow of guns. I promise you, you stop the flow of guns, it would be easy. I'm not saying it would just make it go away, but somebody is bringing the guns in. It's not just falling out the sky. And you're not telling me that a 16-year-old is going to the store and buy these guns. They're not. These guns are being brought in intentionally. And if anybody think I'm crazy, I'll speak to them anytime. The people that know they're doing it, they need to put them in prison because they're making these guns and they're intentionally getting in there because they're disrupting our communities, especially the lower level economic communities. That's just a fact. So I'm sorry to get on this tangent, but I get pissed off about that sometimes. So thank you.
I think one thing I would like us to look at is just what kind of effective measures are out there for reentry, as we talked about, just when kids are coming back, right? And they've been in some type of intensive treatment or whatever. What's there to help support that return home or return to the community or to the environment and sort of seeing what's effective? Because a lot of what, at least I know that we're doing, is a lot of individualized reentry stuff and not really like what's in the community to help keep the youth safe when they come back home, whether they're in the detention center or whether they've served a longer term in ODYS, but really helping kids effectively come back to whatever home community, is.
Yeah.
If I could just very briefly, and I'll get back to you on that. Thank you for raising it, Jennifer. We do hear from kids themselves that jobs, it really makes a difference if you have a viable, job. But if I could just also say, thank you, Patrick, so much for that presentation and pointing out that most kids report that they carry to protect. In fact, I think it's important to also point out that most victims of gun violence are kids. In fact, the U.S. Surgeon General just put out a report saying that we are looking at the #1 killer of kids is guns. So kids may be carrying, but kids are also losing their lives. And so I think it's something we need to be mindful of. Thanks.
Patrick, you were speaking about these violence review panels. And those are generally constituted with representatives from law enforcement, prosecuting attorneys, the judiciary, criminal defense.
They vary by city, and it goes back to what the other gentleman was saying about, who convenes and who they invite, et cetera. The concept is a little bit like a after action or a post-mortem review to really pick apart, like what exactly happened. Could this have been prevented? What prevented? What can we learn to prevent the next incident? I have never been part of one myself, so I'll include a link to some information that's more detailed about in different places who have they included. But the concept is one that everybody has a piece of the information. If we come together, we can share that information and we can all learn about what each of us can do differently as we move forward.
And those
a little bit to in child welfare, there's something called a child fatality review.
Yeah.
So those are, as you said, are post-mortem, so that's after something bad has happened.
That's right.
The other thing that you mentioned, though, were speaking with the council about the possibility of convening stakeholders, and I take it that is on the front end.
Yes, exactly. I mean, that's one where, I mean, again, I don't know the dynamics on the ground, so forgive me if any of this sounds incredibly naive, not knowing your county and the city of Cleveland. But it's one where if you have the data together and the map and the sort of mirror to hold up, you pull in all the folks who, again, have a stake, very importantly, including and starting with the communities that are most affected, and young people themselves, but also the judiciary, the law enforcement, et cetera, and saying, all right, here's what the data are telling us. Here's where we're already invested. If we were to try to bring in something in addition to what we already have, it's going to take some agreement and collaboration to make sure it works. Or, and I think Bridget might have been alluding to this, but you may discover that one of the programs you have that does well some other place isn't doing well in your county for some reason. And maybe it's because people aren't on the same page, right? Maybe everyone's on the same page except probation. So everybody else is trying to go the wraparound route. Probation's going you break one rule, I'm going to bust you and send you back to prison route. So you're not on the same page. So that's why the council convening a group of folks together to really ask those tough questions and say, how do we really, really get on the same page with written agreements, with ongoing meetings where we keep on top of things. You've got, I was telling Bridget the other day on the phone, Cuyahoga County, Ohio in general, but Cuyahoga County has done a phenomenal job in building out the kinds of alternatives to incarceration that you have in place. I mean, it's a very rich menu. There's nothing I could tell you that you don't already know, having Bridget at the table about that. That whatever got you there, it's that same kind of coming together, figuring out what you need together and saying, all right, council's got to put some money up, state's got to put some money up, maybe foundations put money up, judiciary's got to be on board, probation, parole, on and on and on. We gotta, we all got to sign the pledge, because again, it's ICU. It's not. It's really about saving lives. It's intense.
This is kind of a chicken and egg, though, if I understand you correctly. Also, because what you're talking about, if I heard you, you said before you go about the process of calling the stakeholders together, you have to gather your information. Your data's got to be kind of solid. Is that right?
I think you have to have all of the basic data together in a way that it can be presented in an understandable way. I mean, Gabriella's presentation is a great example of that, right? So that's where the state task force got to. I'm sure people walked into that task force not all having the same level of understanding of how the system works. So you have to have enough that people, everybody has it's the old proverb, I guess, everybody has a different part of the elephant. You got to see the whole elephant. Once you've got that together and people are convened, there'll be lots of other data questions that ought to come up that you need to have the capacity to jump on, to get answers to, like by the next meeting. And it's a little bit iterative, right? So one piece of data leads to more questions. That's a good thing. You're learning, right? So we actually at Catalyze Justice, we have a guide for how, whether it's individual leaders or work groups, how to go through a process of design when you're trying to transform youth justice. Again, I'm speaking specifically about gun violence. It's not identical, but that process of data, conversation, more questions, more data, and then, all right, let's start to put stuff in place and try things in the context of now we know, maybe we've got great credible messengers, but they're only in 8 of the 12 toughest neighborhoods. How do we get them in the other 4 neighborhoods? Or maybe they're there and they're reaching, in quotes, the easy young people. They're not reaching the ones who are most likely to walk away from you. What do we have to do? You know, it's all that kind of nitty gritty stuff. And that's why, as the other gentleman said, you know, somebody who's working in law enforcement, somebody's working in probation, somebody's working as a service provider, they're going to be able to tell you, you know, you're not getting the right kids. Like you're not getting the young people who are really most at risk. I'm sorry, I don't mean to ramble on, but it really is this kind of nuts and bolts, you know, kind of getting down to the, excuse the sports analogy, but the blocking and tackling. You know, the concepts are not complicated. Doing them right is hard, though, right? But you've got the muscle, frankly, from what Bridget has told me. You've got the understanding of what it takes. You've done so much good work already. So nobody ought to shrink away from this because it's too hard. You guys have done amazing work.
Okay. Anything else?
Can I just add?
Yeah, go ahead.
I just want to say just, you know, a couple things. One, Gabriella, thank you again, that Cuyahoga County, we've talked about it before, Cuyahoga County is going to be pursuing a CCF in our county. We think that'll be, you know, help us to really intervene on these young people who are at the highest risk, and keep them local so that our local community partners can be very engaged with them. Not only before, but during and after is the goal of a continuum of community-based services for those young people. So that is one thing, since it was brought up. I know we talked about it the last one, just wanted to, you know, say that we will be pursuing that opportunity. 2, we have the OJJDP Continuums of Care, which is a little bit further upstream, not necessarily targeting the deepest end kids, but I think, you know, the work that we're going to be doing in partnership with Catalyzed Justice, third sector, to really think about resources and opportunities for kids further upstream. So hopefully they're never in a situation where they don't feel safe and they have to carry a gun. What are the supports that their families need, their neighborhoods need, their communities need that we can think about? And the last thing is just, you know, many of these things are in bits and pieces, and I think part of what our recommendation could be is how to help bring them maybe together a little bit more, and never forgetting that, you know, these are young people, and we know that if we're not meeting the needs in some way, they're going to find another way to get their needs met. So how do we figure out, you know, if you think about gang activity and stealing cars, things of that nature, very frightening behaviors, but, you know, what does that box, what box is being checked for that young person when they're belonging to a gang? And a lot of time that is about, do I feel safe? Do I feel protected? Do I feel belonged to? So I'm hoping the continuums of care, we can catch young people and their families further upstream before they get into that deep end stuff. But this is very inspiring. Thank you, Patrick and Gabriella, for your long, and this is, your presentations were as brief as you could get them, and I appreciate that, but I know a lot more work of your careers have both gone into both of these things, so we appreciate you sharing your expertise. I think this gives us some really tangible stuff to walk away with and be able to recommend, so thank you, guys.
Thank you. Let me just ask this of you, Gabriella, just so I can make sure I have it clear in my mind's eye. And when we're talking about bringing a CCF to Cuyahoga County, to Cuyahoga County, and we're talking about the CCF being a smaller unit than the detention facilities that we have currently online. Are we talking about a single
Yes.
locale, and that would service the people who are deepest into the system?
Yeah, so currently CCFs are the beds that of the current 11, they're between 15 and 30 beds. So it depends. You know, and I think the smallest is maybe 16 and 30 bed. And they serve as an alternative to DYS could be the very most serious offending young people. It depends on how it gets sort of designed locally. So it's a real diversion potentially from the state facilities. And the state pays for the CCF. So let me just be clear. That's what the benefit, locally is you have the state paying for it, but it's managed by a regional a sort of advisory group, of which this board may be interested in being part of.
Okay. I'm just trying to process.
Yeah, and it's usually shorter lengths of stay too, which is how they're able to then meet the needs of a young person more directly and get them back out in the community versus the languishing that occurs in these larger state facilities.
Okay, so you're talking about people who, for instance, have been charged with like felonious assault.
Yes.
Things of that nature.
Absolutely.
And the empirical evidence suggests that those people are in a position to benefit from having this kind of smaller interaction and the multiple contacts. I think that Patrick was talking about, rather than once a week, you have almost daily interaction with somebody that can help them with mental health. Since, if I understood your stats before, we're talking about close to 70%.
More, that's right.
Or more have mental health issues coming in, and that's the whole population.
That's correct.
Not just the ones who have the most serious offenses.
That's correct. That's right. And I just thank you, Judge, for raising this, because it's less about, I understand why your focus is on the offense, but it's really, the youth system was designed to be individualized and really look at the risks, the strengths, the assets, so that there may be one child who commits a very serious offense, but the circumstances around her or his life may make them really good candidates for CCF versus the prison. So while you obviously want to take the offense into account, it's not the only at all factor in doing that kind of assessment.
Does that mean that some people who come in who are not presenting as having committed something really significant or serious, but who clearly would benefit from having this kind of more personalized interaction, also would be candidates for the CCF?
It could be, and again, these are such great questions, because this is what should inform the design of what our county wants to do. Each region that has a CCF has decided kind of their criteria. Now, one of the recommendations in the report, by the way, so just to warn you, is that there be more uniform criteria across the state with CCFs, because too many of them have refused, frankly, our kids, or refused kids with particular challenges that actually other CCFs have been show that they can actually meet. So that is part of what's being looked at as well.
Okay. Thank you. Appreciate that clarity.
Thank you for the question.
Anything else? Okay. Any miscellaneous business that should come to our attention, Janine? Okay. There being none, is there a motion to adjourn?
I would make the motion to adjourn.
Okay. Second?
Second.
Probably moved and seconded. Any readiness on the motion? Hearing none, we stand adjourned. Thank you.
Thank you.